Hey guys, good afternoon, Dr. Barry. Bringing you another edition of the Lunch and Learn. Again, this is yours truly, your favorite internist, founder at drpierresblog.com, author, speaker, soon-to-be podcaster. I am bringing you this week's Lunch and Learn is actually on location. I actually have a meeting in about 20 minutes, or 15. It looks like 15 minutes. So I actually had to drive to the meeting before I can get set up. But still wanted to kind of give you guys a Lunch and Learn. Today we're going to be talking about sleep apnea. Something that I deal, especially in my practice, quite often, just for the amount of patients who either have a lot of symptoms that are really pointing to sleep apnea but don't even really know it, and ones who already come in been diagnosed kind of first and foremost. So what I wanted to do is kind of go through some symptoms that you may be experiencing. Hey Amanda, how are you doing? We're talking about sleep apnea today. I want to go through 5 things to look for your patients, for someone who may be dealing with sleep apnea, especially if a lot of you haven't been diagnosed like officially, and kind of what to do next, and why treating sleep apnea is so important. So we're gonna again start it out again. Dr. Barry, board certified internist, founder at drpierresblog.com. Thank you for all the replay watchers who may be watching this later on today. I always forget to kind of give you guys your shout out. So again, thank you for all the replay watchers, and then thank you for everyone who's actually watching live with me. So number one, we're gonna talk about sleep apnea. What is some number one sign and symptom? Snoring. So snoring is, and we're not talking about just kind of regular snoring, like very loud, excessive snoring to the point where you affect people down in a different room, to the point where your partner has to kind of sleep in a different bed. And I do have a lot of patients and families who kind of have that kind of arrangement, because one partner sleeps so loud, snores so loud, that if they don't fall asleep before them, they can't fall asleep. So they end up either going to sleep in a different room or the separate beds. But snoring is a very, very common sign and risk factor for sleep apnea. So anytime you take any sleep apnea test, that's one of the questions we always ask, like how much snoring do you do? Number 2, first and foremost, sleep studies. Yep, exactly. Sleep studies are definitive tests for diagnosing sleep apnea. And there's a couple. I actually talk about it at the end, but there's a couple ways to do it. I think we know of the official one, where we kind of go to a different lab and have all these things kind of connected to us. But there, it's getting better, where we're actually having home sleep studies as well, to kind of diagnose sleep apnea right and foremost. So number 1, we talked about snoring being a big risk factor for sleep apnea. Number 2 is if you ever notice you waking up very fatigued. Like you had, a quote unquote great night's sleep. You're in your bed for 8 hours, but you're waking up and you're still like fatigued and not really, not really having energy, to kind of go about your day. That's also a risk factor as well for sleep apnea. So a lot of daytime excessive fatigue is another sign and symptom that we get worried about. And number 3, for people who, especially if you have a partner who can actually watch you, if you've ever had any episodes where like you stop breathing, where you look at your partner and nothing's happening, and then after a couple seconds their body kind of jerks themselves and then kind of wakes them up, and then they take a like a big gasping breath, and then they kind of go right back to sleep. A lot of times these people never actually fully wake up. It's that their body just says like, hey, you know what? This person has stopped breathing for like 20 seconds. Like wake them up for a second, just so they can, take a deep breath in, kind of exhale out, and then they go right back to sleep. So if you've ever noticed, any of your family members, or even if someone's told you yourself that they witnessed that you stopped breathing, that's a big sign and a big risk factor for, being sleep apneic. Number 4. Number 4, we talked about if you ever noticed any signs of like where you were like choking while you were sleeping, choking, gasping for air, like during sleep. You may not do that full deep, that deep breathing, or you may not like fully stop breathing like some people do with sleep apnea. But if you witness like a person kind of choking, or kind of feeling like they're having to grasp for air while they're sleeping when they should be, as comfortable as can be, that's also a risk factor as well for sleep apnea. So those are, that's another risk factor that I get really concerned about, when a patient tells me, that, they witnessed their husband and wife, brother, somebody, chokes during their sleep. So that's definitely that kind of puts a light bulb in my head to think, I really think this person may be having sleep apnea. Number 5, a very common thing is like very common morning headaches. Like every single morning they're waking up with a headache. That's also, it's not a huge risk factor because morning headaches could be a few things, but morning headaches is a big thing that I like to think about if a patient tells me every morning I'm waking up with a headache. And reason being is that when your body, especially with sleep apnea is pretty much your body going through periods of time where you have kind of no oxygen in your system. So it's no oxygen's kind of getting to the brain. And this happens repeatedly over and over and over throughout the night. So if you have some patients when, especially as severe apneic patients, they go through, minutes, hours, throughout an 8-hour period where their oxygen levels aren't sufficient to kind of keep up with demand. So when you wake up in the morning, a lot of times you end up getting sleep apneic. And hey Jackie, how you doing? Thank you for sharing. You end up getting headaches when you wake up in the morning. So let's go through the first 5 that we talked about. And there's a few more, but these are 5 I like to ask, especially when I'm concerned about sleep apnea. One, are you a really bad snorer? Again, not just a regular snoring. I'm talking about one that kind of clears the room, one that people hear you across, 2-3 different rooms, one where your partner has to either sleep in a different bed or, go to sleep before you, or they can't go to sleep, that type of snoring. Are you that? So that's number 1. Number 2, are you the type that will stop breathing in the middle of the night? You'll see your family member, you see your partner, and they'll just stop breathing for 10 seconds and then do a big gasp in air. That's another a risk factor for sleep apnea. Number 3, we talked about the choking sensation, where you have this choking sensation where you're even though you may not have those periods where you stop breathing, but you're having this sensation where you're trying to catch your breath throughout the night. And sometimes it depends on the position, especially if I have a lot of people who lay on their back. They really experience that symptom a lot more than most people who don't. Number 4, we talked about you waking up, you had 8 hours of good sleep, and then you're still fatigued, you're still tired throughout the day, you still having sometimes you're even falling asleep almost at the wheel because you're so tired, even though you had a good night's sleep. There's no excuse for you to be tired, but you're still waking up tired. That's a risk factor as well for sleep apnea. So that's something I like to be very mindful on. And then the 5th one, again, which isn't severe, but it's something I always ask, is are you having any issues with morning headaches? If you're waking up with headaches on a consistent basis over and over and over again, we definitely want to make sure sleep apnea is not a concern for you, because again, that's that is definitely a risk factor, especially if your body's going through these long periods of time where your oxygen level just isn't there. Hey, Dr. Tamika, thank you for joining. Dr. Tamika, we're talking about sleep apnea. We went through the 5 common signs that I like to ask, especially in my patients for sleep apnea. So we talked about we'll go through again with number 1, really loud snorers. Number 2, people who go through periods throughout the night, and it could be 10 seconds, 30 seconds, whatever, where they stop breathing, where you look at them, looking at the body, and nothing's moving. Number 2, we talked about people who choke while they're sleeping, or grasp for air while they're sleeping. Number 3, notice that was 3. Number 4, we talked about morning headaches, a lot of morning headaches. Number 5, we talked about this excessive fatigue during the day. Very good point. So narcolepsy, that's a very good point, because narcolepsy isn't a necessary due to the oxygen level. So narcoleptic patients, they could have a great night's sleep, they could have no excessive fatigue, and then all of a sudden, boom, they're out. And that's more of a chemical imbalance, a neurological issue, more than the sleep apnea, where we're concerned more of an oxygen requirement or oxygen deficiency in that point. But very good question, especially because when we talk about narcolepsy, when we talk about sleep apnea, there's definitely 2 different ways that we treat it. My narcoleptic patients, we actually give them stimulant medications to kind of keep them up. I have a couple patients in my practice with that. We actually give them medications to keep their mind firing, because sometimes all it takes is that little lull period, and then they're out, they're sleeping. And it can happen anywhere. They could be driving, they could be walking, they could happen anywhere, and the problems arise. But for sleep apneic patients, they tend to have like daytime fatigue where they're just kind of drowsy. They're just kind of just getting throughout the day. And again, these are the people who get a good night's sleep and it still doesn't seem to matter for them. So as an internist, why is it important to, for me to even be worried about sleep apnea? Because we know, especially from a medicine standpoint, that if you have sleep apnea, like I have a much more difficult time getting you to lose weight. I have a much more difficult time getting you to control your blood pressure. Much more difficult time getting you to control your diabetes. I know that if I don't do anything about your sleep apnea, you're at a more increased risk to get heart disease. You're at an increased risk to get seizures. Because again, seizures, especially if you're going through long periods of time when your oxygen levels aren't adequate, seizure risk increases twofold. Irregular heart rhythms. Again, if you're having long periods of time throughout the night where your oxygen levels are, not sufficient for your body's demand, your heart will actually go into an irregular rhythm. I think during residency, probably my most, poignant example, during residency, we had a patient who came in who had like a third-degree heart block, which again, you don't really need to know what third-degree heart block is, just know it's not a good heart rhythm. And while this patient was sleeping, because we're looking at him on the monitor, while this patient is sleeping, this person goes into this irregular heart rhythm, and we're like, oh wow, so we go to Ren and we thinking something's happening, and he's just asleep. And then we go to wake him up, and heart rhythm goes right back to normal. And this was happening, repeatedly. So we end up having to put a pacemaker in him. So again, this isn't a disease that's without risk factors. This is something, especially it kind of seems innocuous, but it's definitely something that we definitely want to make sure that we're asking the questions. We definitely want to make sure that we're being as diligent as possible, because we know that the risk factors are there from that standpoint. So again, I just wanted to kind of touch base, because I think we talked about sleep habits like a couple episodes ago. So I definitely wanted to kind of hit home sleep apnea, especially because I think if you're familiar with worldstar.com, Worldstar Hip Hop, I think the website's called, one the founder actually died in his sleep. And they were concerned for heart disease, but the second I saw, I saw his body habitus, because risk factors for sleep apnea. One, if you're a male, so being a male puts you at a greater risk for having sleep apnea. Two, being obese, so a BMI I think of over 35 is what the guidelines are saying now. So if you're obese, a greater risk factor. Again, not to say skinny people can't have it. I want to make sure we get that out the way. Skinny people can definitely have sleep apnea, but you are at increased risk if you are obese. 3, the age. So if you're, I think, over the age of 55, you're at an increased risk for having sleep apnea. Again, this is regardless of weight and exercise and everything else from that standpoint there. And then your neck size. I measure the neck size, especially when I'm concerned, but I usually kind of let my sleep medicine people do that, because we know the neck size plays a risk factor as well as far as patients, having sleep apnea. Does apnea run in families? It does not, because especially most of the most common form of apnea is obstructive in nature. So a lot of it is just a very anatomically, if you're not blessed in that way, anatomically, you can have some restriction in the breathing. So it doesn't run in families, but what tends to run in families is those risk factors, in terms of obesity, large necks, male. So that's where we kind of get that that family correlation, but it doesn't necessarily run into families in that regards. So again, guys, hey Maria, thanks for joining. Thanks for guys for joining. Again, I'm actually headed to a meeting as we speak. I'm about to leave the car right now, but if you've not had a chance, again, today is the last day to get my free ebook, drpiersblog.com/free book. Someone go ahead and post that in the comments for me. Get your free ebook today. Tomorrow, 2nd February comes around, it won't be for free, it will be for sale for that regards. But if you haven't signed up for the listserv, drpiersblog.com, go ahead and check that out. You guys have been great. I will see you guys Thursday.